Headquarters of common sense.
Talk Radio.
Let's talk to Dr. John Lee. Dr. John, a very good afternoon to you.
Hello.
Thank you very much for joining us. I'm slightly perturbed, I have to say, by the way the NHS appears to be going. You and I have spoken about it many times before. People worry about the privatisation of it, but what I worry about is this sort of bottomless pit of money that it seems to have turned into, which doesn't really work very well. And we're now being told that if you can't get yourself onto a waiting list which lasts less than 18 months, don't worry, we'll pay you to go private.
Yes, well, I mean, I think this is a fix for a big problem, isn't it? But I think I should say that, I mean, as an NHS consultant myself, I did minimal private practice during my career, and I come from a family. My father was a doctor as well, and he did minimal private practice. So, you know, I believe in the NHS in terms of a national health service being free at the point of need for people. But I progressively feel, unfortunately, that despite the utopian ideals of the NHS, it simply doesn't work as a monolithic state-run organisation. And I mean, the bottom line is giving people the care that they need when they need it. And I think that the NHS is manifestly failing now, and it's been manifestly failing for a long time, actually, to do that. So I personally think we're going to need to move from the model that we've got to a model that's more fit for the modern world.
Yes. And I mean, I talk to an awful lot of different doctors about this, and we try to find little solutions for parts of it because, you know, there are bits of it that work pretty well. I mean, it's still a pretty decent service. If you happen to be in an accident and you're rushed to accident emergency, you'll normally probably got a better chance of survival than you have in most countries. That's fantastic. But anything that's kind of elective, anything that requires you to see a doctor because you're worried about something, just seems to have sort of ground to a halt, doesn't it?
Well, I mean, obviously we've had extraordinary times, and I mean, one of the key things that I and others were talking about from the beginning of the pandemic, that if the government is going to set itself up as the nation's doctor, it's got to act like a doctor. And if you're acting like a doctor, the first thing you do before you sort of predicate any drastic treatment for anything is follow the principle first, do no harm. So if you're going to lock down people and introduce all the things that the government did over the pandemic, you've got to consider what the side effects of that are going to be. And the side effects in terms of the health service, we're now seeing, you know, in spades, has been pretty disastrous, hasn't it? I mean, I just feel that the trouble with the health service is that whenever you have a system which has no cap on demand, it becomes unmanageable. And the trouble with the health service is that people have been encouraged by successive governments of all stripes to, you know, it's your health service, you should use it for what you want, have what you want, turn up when you want, and all this sort of stuff. And the fact is that makes as you say, it's a bottomless pit of demand. And it's very difficult for anybody, however good the management is, to manage it. And unfortunately, the management of the health service is often rather lacking, in my opinion. So we've got two problems there. But the bottomless pit of demand, we have to do something about that. My solution for it would be to move to a system where we have a state-provided health service for basic care, but that people have to buy their own health insurance, so that there are multiple competing providers for health insurance, which would drive the standards up. I mean, the trouble with it, unfortunately, is when you have a monolithic state-run organisation, you know, standards tend to go where they go with public service, unfortunately, which is not very good. So no manager would have lost their job during COVID, for example, for the way that they dealt with the COVID crisis. And we know there have been some awful things, you know, people not being able to visit dying relatives, you know, people kept away from hospital, GPs still not seeing patients even now, which is a scandal of enormous proportions, in my opinion. We've got to do something about this.
Oh, I think so. Because there's no question, is there, at all, that there's an awful lot of people who complain that they can't see a doctor when they want to, even though a lot of doctors will tell you, well, a lot of people are quite happy with virtual appointments and they're quite happy with video examinations. And I'm sure that's true to some extent, but for most people, they want to be able to see a doctor and sit with a doctor if they've got something wrong. We hear from the doctor's side of things that sometimes people are frivolous in their reasoning, but surely that's not the point. And it seems to me that we're at this point now where reform is required, and so somebody's going to have to come up with some quite radical thoughts, perhaps.
Yeah, I mean, as I say, I've been an NHS person for my entire career, and I do believe in it. But on the other hand, I do think that the inability to have a public discussion about this is a big problem in the UK. We need to be able to talk about the NHS honestly. So, for example, I don't even think we necessarily need to be that radical about some of the things we do. So I think we should apply the plastic bag principle to the NHS. So when we wanted to reduce people's use of plastic bags, we introduced a 5p charge. Yeah. And usage went down by 95% because that 5p made people consider, do I really need one or not? So my opinion is that actually even if you introduced a £1 or a £2 or a £5 charge for seeing a GP, and even if that was virtual money, even if you introduced a virtual health budget, which the government was thinking of doing 2 or 3 years ago, but then was shouted down and couldn't even debate it. Something like that would make people consider whether the appointment that they want to have now is absolutely necessary. And I think actually something as minor as that could make a big change to the amount of demand that there is in the NHS, and that would actually, could have a drastic effect on it. So I think we don't need to be that radical, but we do need to actually talk about it, and we do need to actually seriously think about new solutions for the NHS, because it's manifestly not working properly and not giving the care that we would want, ourselves and our families to have at the moment.
No, quite. Interesting what you said about private healthcare as well, in that you didn't really practice much of that, and neither did your father. So that very much would appear to be a choice that's made by each individual doctor then, as to how much private work they do. I've also talked to a lot of doctors who have gone part-time now, who now do, say, 3 days a week instead of 5. We're hearing that they're going to be told to open on a Saturday morning and possibly in some evenings as well. There's lots of talk going on, but, there is clearly a recruitment problem as well, isn't there?
Well, there is a recruitment problem. There's also a problem with people leaving early. I mean, I left the health service early. I took early retirement at 56 because I could not work in the management structure anymore. It's not enjoyable. And the trouble with it is that part of what people used to do, a lot of people, particularly in general practice, used to do, is when they got to a certain age and they didn't want a full-time job anymore, they would go down to, say, 1 day a week. But they would still go in and they'd be a mentor for the practice, and they'd help the young doctors learn how to run a practice and do what they have to do. But one of the things that has been introduced in recent years is revalidation for doctors, which I'm not against in principle, but I am against in terms of a one-size-fits-all. The amount of revalidation you have to do as a 1 day a week person is the same as you have to do as a full-time person. So that is, a lot of people now no longer think it's worth the candle and they just leave. That's bad for the for the experience in the NHS.
Yes, but also what's bad is that when people get told, well, we can't see you for about 6 months or maybe a year if you want something done with your knee or something, but if you want to go private, we do it tomorrow.
Well, there's that, and obviously people do make choices, and it's the same people doing the NHS and the private work, basically, depending on how they want to earn their money. But I think the problem with it is, and we mentioned it just now, you said about a lot of patients are happy with virtual appointments. The thing about virtual appointments is they can contribute to healthcare, but they're not medicine. When you're a doctor, it's vitally important. When you see that person walk in the room, you get an immediate feel for whether they're, inverted commas, well or whether they're not very well. You get an immediate feel for whether the problem they're coming to you with is the only problem they're coming to you with, or whether there's other things going on. You simply cannot, in my opinion, make that judgment properly on the telephone, even with visual telephone. And I think the way that the health service has tried to cut corners essentially during the pandemic, and now as we come out, as we finish the pandemic, as they're trying to go forward by trying to maintain that we can see lots more patients by not really seeing them. Well, I say it might be healthcare, but it's not medicine, in my opinion, and I think you're getting a second-rate service if that's what you're having.
Yes, I think that's right, because I think there have been too many sort of management consultants drafted in, too many people who are not actually medics, too many people who are administrators and net zero coordinators and that kind of thing. And, millions and millions of pounds wasted on things which are not technically clinical at all. And I think that there comes a time, does there not, John, when you think, could we split it up in more ways so that it's no longer just one monolithic institution, and it actually, you could separate the hospitals out from the GPs, you could separate, the pharmacies away from, the therapeutic clinics or something. It just seems to me it's too big.
It is too big to manage properly, but because the government inadvertently did this themselves, because they, some years ago, made all NHS trusts independent trusts. So it's a sort of a myth that we've got a national health service at the moment anyway, because we've got, I don't know how many it is, 600 NHS trusts up and down the country in hospital care, and they all made their own rules up for COVID. Well, that's not a national health service. Right. I mean, it's a bit random what you get. So I think there are things that should be national, that there should be a standard of care over the whole country. And so the pandemic, for example, was a good example where actually the government should have determined whether you were allowed to go and see a relative in hospital, not some hospital administrator. I think that was completely wrong. On the other hand, there are some things that are better managed locally. The real issue is that most management in the NHS is done by people who've never done the job. They're managers, they're not medically trained, they haven't done medicine. And of course, if you just bring in a manager to a private company, say, who's got no real experience of the actual work that's done in the company, well, you get what you get, isn't it? Which is often not a great outcome. No. Unfortunately, we've got that embedded in the health service. So we really do need to do something about it. But the first step, surely the first step, is we've got to start having an honest national debate about it. And that means when somebody in government or in power raises the issue of the fact that we need to do things differently in the NHS, we can't simply have the opposition screaming blue murder, la la la, I don't want to hear it. We've got to have a grown-up public debate about the NHS.
Yeah, absolutely right. Because at the end of the day, we are going to be supposedly, unless the government does a U-turn on it, which is not out of the question, we're going to be paying another 1.25% on our national insurance, supposedly to reduce this particular backlog of patients on waiting lists. But we've also been told that even if that starts to happen, it'll be 5 years before you really see the benefit. People can't wait 5 years.
No, it's quite wrong to suggest that, it's only a bad hip you've got, it's not life-threatening. But these things actually mess people's lives up.
Yeah.
If you can't walk or to the shop or go out for a stroll because you're in pain, I mean, this is exactly the sort of stuff that the health service is there to do. So it isn't reasonable to suggest that people can just wait this length of time. And we have to. That's why I say that we cannot properly manage a system that has no cap on demand. So we need basic level care, emergency care, and serious things that need high-tech treatment. We need to have some sort of a national system for those, in my opinion. But we should also back that up, like other countries do. I mean, I think Germany has a model a bit like this, like other countries do, with a private healthcare system where you can buy the level of care that you can afford and that you want to buy on top of the basic level of care. And that allows people to basically manage their own demand, depending on how much they're willing to pay for it. It also means that if you, say, have, like Germany does, 50 or 60 healthcare providers, it means that people can vote with their feet, because basically, if you're a healthcare provider that is giving rubbish service, people won't come to you, they'll go somewhere else. Yeah. In the health service, you sort of can't go anywhere else. The only thing you can do is pay double, pay in your taxes, and then pay privately. And a lot of people don't agree with that. So we need to have some sort of a model fit for the 21st century, and we certainly haven't got it now. No.
And I mean, what would be your first act if you were given permission to do something, just to sort of set the ball rolling, just so that you could prove to people that, it's nothing to be frightened of this. We're not trying to destroy anything. We're not trying to sell it off to Donald Trump. Just want to make it better.
No, well, that's the trouble. I mean, because people aren't willing to think about it or discuss it, nobody gets to make any suggestions, which is just not the way to do it. So my first thing would be to start with the plastic bag principle. I would say we'll introduce virtual health budgets, unless you've got a chronic condition or something, in which case you can make exceptions. But we'd introduce virtual health budgets. Everybody's got even a nominal £50 a year, and it costs you, say, a nominal £10 a year out of that nominal health budget to see a GP. I think you find a dramatic effect on demand just by something as simple as that, and then that would be the first step.
Yeah, excellent stuff. Dr. John Lee, thank you very much indeed, former NHS consultant there.
Good talk.
Hot talk. Bold talk. Talk radio.
Listen on your smart speaker.
Watch it live on your smart TV.
The world headquarters of common sense.
Talk Radio.